Well, thank you everyone for joining this session at the Home Within Reach Conference. My name is Rich Kistner. I'm Executive Director for Community Strategies Group. We are a nonprofit housing developer and property manager in Bloomsburg, PA. My staff manages 289 units. We have about 53 more in production. Our properties consist of public housing, LIHTC, market rate home, elderly, family, folks with special needs, victims of domestic violence. So we've experienced all kinds of different challenges throughout the pandemic with each project and population, presenting different challenges. So hopefully today we'll be able to have an open conversation. We'll get some feedback from you all. We also have, and it's going to be our main presenter today, Layla Geibel is from the Butler County Housing Authority. They have a lot more units than we do. And again, they have a whole variety of different types of projects and populations. And again, hopefully we'll bring some really great ideas for what they've been doing. And I think probably more importantly, how these lessons learned could impact the way we do business down the road, either through future pandemics, which hopefully we'll never see, but just in general, I think there's a lot of things we've learned that are going to make our work even more efficient. So we're going to cover some different topics today. Some of the things in general will be, those day-to-day activities, like research and collecting rents, interviews, leases, that kind of thing. We'll talk some more about evictions. We'll talk about, dealing with residents and some of their needs, whether it be, trying to coach them as to how they should be taking precautions, how they should be communicating with management and maintenance, whatnot. And again, we'll talk about lessons learned. So with that, I'm going to turn it over to Layla. I'm going to let Layla do an introduction herself. She can tell you a little bit more about her background and experience, and we'll let her get started. First of all, with how they're dealing with those day-to-day activities. So Layla, I'll turn it over to you.
Thanks, Rich. Good afternoon, everybody. My name is Layla Geibel, and I'm a property manager here at the Housing Authority of the County of Butler in Butler, Pennsylvania. I've held the position of property manager for the past 11 years, but I've been employed here for 21 years, and I've worked in the capacity of property manager, assistant property manager. I was a Section 8 coordinator, management aide, administrative assistant to the executive director's office. So I have a little feel of a little bit of everything. I've worked in pretty much every department here in the Housing Authority. I manage 452 public housing units. I have myself and I have an assistant property manager. We do all the day-to-day operations, the recertifications, the leases, the interviews, the hearings, the inspections. We do it all. So that's a lot of property to manage with two people, but we get the job done. I mainly have a senior high rise. I do have some families. I have a little under 50 units of families and a little over 400 of elderly sites. We do have tax credits and other kind of miscellaneous properties at the Housing Authority. We have a separate manager for those properties. We have a little over 200 tax credits. We also have about 1,500 Section 8 vouchers. So I think that we're pretty much a medium-sized housing authority. So I'm just going to go over things that we do, excuse me, on a daily basis, and hopefully you're able to get some ideas as to, oh, that's a good idea. Hopefully we can implement that and make our jobs a little bit easier during these crazy times. So the first thing that we're going to touch on is our offices. So we just have a central office. We do not have offices in each of our sites. And I know that that's different from a lot of people. Most people have offices within their buildings, within their properties. So we just have one central location. And so our hours are the same. We are in the office right now, but we are closed to the public. So we are not allowing anybody in and out of our office. It's kind of like, excuse me, our safe space here. So we do everything kind of remotely. We were working at home for about 6 weeks, and it's a hard business to be able to work from home, you know. So we are taking appointments, but we're trying to limit them. We're trying to do them over the phone, doing as many things as we can without actually bringing people into our office. If we absolutely have to have somebody come in, we're doing pretty much the same thing. Probably everybody's doing temperature checks at the door, you know, making sure they wear a mask, and then keeping them in one room and then sanitizing it when they leave. So, but like I said, we really try to limit that and not have people in and out of our office. So, Rich, I don't know where your office is. Are you guys open to the public?
No, our offices are locked as well. We did install a doorbell and a sign that if someone does need assistance, they can, you know, ring the bell. We'll go out and meet with them, or we have our phone numbers posted on the door. They can call as well. But yeah, for the most part, everything's locked up, and some staff are in the office. Those that can work from home are encouraged to do so whenever possible. As you mentioned, there are certain things you just can't do from home, but we've been trying to minimize, you know, contact with each other and with our tenants to the extent possible.
Keep everybody safe, I think, is the main objective for everybody. So with that, and Rich and I had talked when we were doing our planning sessions about a lockbox or a drop box, excuse me, that we had installed. I think, Rich, you also had one installed at your office.
Yeah, I mean, folks were just accustomed to coming and dropping stuff off, coming in the door, and you know, unneeded contact. So a simple drop box, and at first people were a little bit reluctant, but now it seems to be commonplace. So, you know, again, it's something that not a big deal, not a lot of time wasted for a reception to take those packages, but it is time saved. So, you know, something that will increase productivity, as slight as it might be. Every little bit helps. So, again, one lesson learned that, you know, going to be positive.
Yeah, absolutely. And like we had spoke earlier, and I said I don't know how we did business without that Dropbox for as long as we did. It's been really nice and convenient even after hours. You know, if someone's working and can't get here. We also had a camera installed right outside the door that shows the lockbox, because we still have people that want to pay cash and, you know, come here with no envelope or anything and just want to drop it in the box, and that's fine. But at least we can see it just in case something would happen. We have that camera there. We started out with just a small Dropbox because I don't think we really understood what we would, you know, be getting into with that. And then about a couple weeks later, I mean, it was so full and couldn't get stuff in, we installed an even bigger one. So that's been great for us. The Dropbox after hours, we check it multiple times a day. And so even when someone comes and rings the doorbell, I'm here to see somebody, I'm here to drop off paperwork. You know, we encourage them, so we don't have to have any contact. Please just put it in the Dropbox. We will get to it. You know, we'll check it, you know, within an hour. So like you said, people are still a little bit reluctant, but I think they're getting comfortable and getting used to it, because I think that's pretty much how it is everywhere. So that's been great for us.
I would like to encourage everyone to, if you have ideas of your own or things that you've done to help manage this, you know, pandemic, you know, lessons learned that would be good to share, please do so. Send that into the chat. We want this to be interactive. I think we all understand that there's probably no one right answer, and every circumstance is going to be a little bit different, whether it be, you know, your actual office configuration, you know, where your staff are located. So we're certainly not going to cover all of the issues, but again, please feel free to share any ideas that you have that we could pass on to the rest.
Great point. Yeah, just to clarify that, there is no right or wrong way to do things. We're all kind of, you know, learning as we go. And we're just doing what works best for us. But, I would love to hear other ideas. I spoke at a power conference a couple months ago on a virtual kind of set up like this. And it was really nice. We got a lot of, idea sharing, and I understand that I'm a housing authority and I know we have other housing authorities on here, but not everybody is that. So, some things will work for them and some things won't. So, yeah, like Rich said, utilize the chat option and, ask questions and any ideas that anybody has is great. No right or wrong way. So going to touch on annual recertifications. I think everybody pretty much does something like that of some sort. We used to go to the properties and meet with the residents individually. Me and my assistant, we'd have appointments scheduled, and we met with every person. Got the live information, had them sign the papers in front of us. So obviously, this year we weren't able to do that. So we had just looked up their information in the computer, and we prepared packets for each individual person. We labeled each one of our papers that they needed signed, and then gave them a detailed letter as to what they were actually signing. A lot of people actually still want to know what they're signing their name to. So, and then we just had them either deliver it back to our Dropbox or give it to the maintenance man in our maintenance shop. And then we would go pick it up from there like once a week. We gave about like a 2-week timeline to get everything signed and all their papers back to us, so then we can then process the recertifications. And that's been great. My biggest building that I have 160 apartments in one building. So that took me and my assistant about 3 to 4 days of sitting there every day doing recertification appointments. And it's, very, very time consuming and, not something I looked forward to that week of the year. So this has been great. And this is going to be one of those things that going forward, if there is an after COVID, that we're probably just going to keep doing like this. I think it's safer for everybody. I don't know how many times I come down there, I do the appointments with the residents and they're sick and hacking all over the place. And, so even just that, I always seem to get some sort of illness after I'm at a week at recertification. So I like the whole no contact, and that's going to be something that we're going to look into, is probably keeping that just with the packets that we mail out.
Yeah, so someone just shared that they installed a ring to
great idea.
to communicate with people. Yeah.
So that just means whenever they would ring the doorbell, then the camera comes on, and then someone can just reply, through the video communication. That's a great idea.
Layla, a question while we're on the topic. How do you get your recert packets to the residents?
So, obviously it's, going to be very expensive for me to mail out, a big envelope to each resident full of papers. So we actually were delivering them and just sliding them under the doors, in the building, in and out, trying to limit as much as possible that we're not going in the buildings. But something like that's going to save a lot of money on postage. It's just easier for us to just go slide it under their doors and with a, detailed instruction.
I know for us, we have different different ways for different buildings. Some of our buildings have a little a drop box in the lobby, so that made it easy. Some we actually mail from the office. We do spend that postage. And others we have slide under the door. So really, I think it depends on your property. And
Sure.
Obviously we don't want to spend postage when we need to, but it's, not a whole lot if you have smaller properties.
Yeah, sure. I do have my family sites I have a lot of single family detached, and they're kind of just located throughout the city of Butler. So that would be very time consuming. So because we don't have a lot of those will throw through the mail machine. But most of them, in one building, we'll just go and just slide them under the doors. I have my recertifications spread out throughout the year, one building per month. We don't do them per anniversary date of their lease up. We do them based on that building is, in a September recertification. So it's pretty easy to just, go to the building, slide them under the doors. And like you said, that doesn't work for everything. So the other ones we'll throw in the mail.
Another comment, someone uses Facebook Live for their community groups and events. Another
Great
great tool.
idea.
Yeah.
Yeah.
Layla, just,
I
just so we, we can cover all of our topics, what about other, I'll call it day-to-day tasks for property managers, collecting rents, receiving applications, interviews. I assume all similar type of changes that you've made. Anything stand out that you would want to call out specifically that has been very beneficial?
Probably the biggest challenge that we're seeing is with the interviews. You know, getting the information that we need over the phone. We really like to meet the people and see them and meet them, and before we actually put them in the building, and we're meeting them at the day of lease up. So that's probably our biggest challenge. We used to have them bring in all their information at once when they came in for an interview, and now it kind of seems like the information trickles in. So I feel like the whole process has slowed down a little bit. But as far as, that's what we're trying to do over the phone. The lease ups we're doing, instead of bringing them in, or if possible, we'll meet them at the property and do it like in the apartment if the tenant's able to, be able to stand at the counter. Although it's not ideal, we've been asking people to come to our office, and we'll bring out all the information on a clipboard and leave it to them in their car. And then we'll call them over the phone and go over the lease packet information as they sign it and review it. And then we'll come back out and get it, just to try to limit, any kind of face-to-face interactions that we have with them. So although not ideal, it's working for now. I don't know that those are going to be things that we will continue to do. I hate to say after COVID, but if the times change again. Inspections, and if you want to talk about inspections, that's another part of our I do annual inspections for all of my elderly high rise, but my family units, they require quarterly, if not monthly inspections. And they've really taken advantage of me not being able to come to the properties. We haven't been able to do that. And, when maintenance goes in to do a work order, they're letting us know this apartment is really bad, and then we have to go out and do it. So they're really taking advantage of knowing that we're not able to come out to the sites. And I know that other housing authorities are having the same issues. And as of right now, I don't have a time frame as to when we'll be able to go back into the sites and actually conduct inspections. I know some people are doing them virtually, if they have the capability through Zoom or FaceTime, if they have an iPhone or something like that. I know some housing authorities were conducting them that way. And the same with apartment showings, doing them that way. I thought that was really kind of innovative for a certain type. Uh, like a lot of my elderly people don't have iPhones or don't know how to use FaceTime or Zoom or any of those things. So that kind of creates a little bit of a problem for those things. But I like the idea of it. And, that's the kind of day and age we live in now, that kind of virtual everything. So that was just a good idea that some people are just, they're just doing what they can.
So we have it. We'll get to some maintenance stuff in a little bit, but specifically we have a question regarding maintenance staff's interaction with tenants, for repairs. I know for us, we have been encouraging our tenants to still continue to let us know whenever there's any kind of issues. But if it's something that's not life threatening or, has a potential to, further cause damage, we've been trying to, put them off as much as we can. Hopefully we won't have multiple repairs, but, that does happen. So maybe, instead of going in for one small thing, we'll just let it go until maybe there's an inspection or something else at that point. But when our staff do go in, they do wear a mask, and they do wear gloves, and they ask if anyone in the household has any of the symptoms. That's for the most part how we've handled it. no major changes. Leila, how about you and your staff?
Pretty much the same thing. We're trying to work on emergency work orders only, but obviously, we don't want them to pile up, so we're trying to get to what we can. Like a drippy faucet, if it's just a slow drip, we're kind of putting that kind of thing off. And we tell maintenance, that's up to them if they don't feel comfortable or they feel that this person, looks ill or they don't have to go in if they don't feel comfortable going in. They are wearing masks and gloves. And when I did my last session, other housing authorities were giving their ideas as to what their maintenance staff was doing. And some of them would have the resident ask them to step outside while they, outside in the hallway while they worked in their apartment. And anything they touched, they would wipe down with like a, sanitizing rag after they were done. And so then that way they limited any kind of, and I will say that in my buildings and like everybody else's, they don't have to let us know if they have COVID, if they've been exposed. We don't get any word from the health department, even though we're a huge apartment complex, that let us know that, hey, you have a COVID case in your building, which I understand that. We've only had 2 people that have self-reported to us that they had it in one building, and they reported it to us after they were back out of the hospital and have been cleared. But our maintenance staff is wiping down our buildings every day, the handrails, just public things that they would touch, doorknobs going in and out of the doors, in and out of the building, those sort of things. They're not wiping down individual apartment doors or anything like that, but elevator buttons, that kind of stuff. They're sanitizing on a daily basis, which I know, they spend all this time doing it, and then someone comes in and touches it, and it doesn't really, it's dirty again. But we're just doing what we can with the manpower that we have, and right now it seems to be working. I mean, like I said, some people were not happy because they're used to getting a work order done within a certain time frame, and now we're kind of trying to push those things off. So but for the most part, everyone's been real receptive of everything and has been helping. So we haven't really run into any issues, knock on wood, that maintenance has had with any residents and vice versa. So, hopefully we can get back in and, regular business here sooner rather than later.
I know we've had to change the way we've done things just through guidance from the CDC, other state and local guidance. So initially when this first hit, we all reacted a little slow at first, and then really ramped up. And then as the cases started to level out here in the summer and early fall, we came a little more lax, and now with the spikes, we're back at doing as diligent as we can. So it has been a roller coaster ride for us, just to try and keep ahead of it and learn from everyone else throughout the whole course of this.
Well, that brings me to, I wanted to ask you, so we touched on maintenance staff. What about your residents? Are you mandating them or trying to enforce somehow them mask wearing and social distancing or anything like that?
Yes, tenants are required to wear a mask whenever they're in any kind of common spaces, obviously not in their unit. If they choose to have guests in their unit or, get together with tenants in their own unit, obviously we don't require them to wear a mask at that point. But if they are in the hallways, entering, exiting the building, taking trash out, going for mail, they are required to wear a mask. We at one point closed down all of the common areas, so the community rooms. We have a couple card rooms, and again, the projects vary. We do have a couple projects that still have common laundries. So obviously we couldn't close those down, but we, posted, to try and minimize the number of folks that were using the laundry at the same time. And again, that's varied too with guidance. And when things are really ramping up, we've been a little bit more diligent. We do have hand sanitizers. We had those installed in all of our buildings. As you come in, we encourage people to use those. Wipe down, if they are using the community facilities, wipe down the things that they may have used. And for the most part, everyone's been really cooperative. We've asked people to limit the time spent in the common areas, which has been really difficult. I think one of the big advantages to a lot of our properties for seniors is that social interaction, and they're not isolated like they maybe once were. And that's we've had so many people tell us how happy and how thankful they are that they were able to move into facilities like we all have, for those reasons. And then to be able to take that social interaction away from them has been really tough on a lot of them, emotionally. So um, that's something that we have struggled with, is how to try and keep um, people active. We've tried some different things. Our support service folks have tried different programming, but as you mentioned, a lot of the seniors don't have the same resources that our younger people do to be able to interact through social media and whatnot. So maybe that'd be a question for you or anyone else in the audience, is how have you dealt with tenants and that need for them to have some social interaction and not feel isolated. I don't know if anyone has any ideas on that. I'd love to hear.
Yeah, I agree. I think that's been one of our biggest challenges for the residents. They really miss that whole social aspect, the bingos, the socials, the card club, the community dinners and things that they were having. We also did close all of our community rooms. We did leave our computer rooms open for them to utilize the computers and hope that they wipe it down after they use it. We only have about 2 per building, and not many people utilize them, but we did leave that open for them. But the whole community room with the community TV and those sort of things, that's all been locked up. We also do kind of have our buildings on, I don't want to use the word lockdown, but limited access maybe, that we're hoping not to really have guests come in, just essential personnel like an aide or somebody dropping off groceries or things like that, to limit people coming in that don't really need to be there. And I know that doesn't really help on the whole social aspect either, when they're keeping their families from them. But we also have told them about the mask wearing, but majority of my people in there, they're 50 and older in my buildings, and majority of them are actually over 62 and are elderly and all have breathing issues, so majority of them say they can't wear masks. So that was going to be something I was going to ask you. Is there any kind of, I don't want to use the word punishment, but what do you do if somebody just refuses to wear a mask? We've just been telling people, here's what the CDC guidelines are. You need to do what you need to do to protect yourself. This is what the CDC says that we're recommending you do. And we ask that when you're in the common areas, you wear a mask. But understand that you have a medical reason you cannot. And we run into that a lot. We're the mask police now. Everybody's calling in, this person's not wearing a mask, this person's not wearing a mask. And my answer to them is simply, you don't know what their health issues are. And not to be mean, but it's none of your business. Worry about yourself, protect yourself, and that's all you can do. Stay 6 feet away from them, protect yourself, and you should be okay. So are you doing anything? I know some housing authorities were actually rewarding people for wearing masks. One housing authority was handing out lollipops every time they saw someone with a mask on, which I like the idea, but then I'm like, well, then they'd have to put their mask down to use their lollipop. So, but I like any kind of ideas like that, and trying to like positive reinforcement to help that, as opposed to penalizing anybody for not doing it.
We have some questions. I think I'll save a couple of them, for the end. But since we are talking about staff and maintenance and whatnot, one question here about do we train our maintenance people about identifying people that are sick, or how to react to those kinds of situations. And for us, We share all of any guidance that we get that would pertain to maintenance or anyone else entering the buildings. We share that guidance. We recognize we're not experts at this, so we just make sure, and we know that our maintenance staff aren't, receiving all of the guidance and emails and updates that we are here in the office. So we're just diligent about making sure that any guidance that we get gets distributed onto our maintenance staff. And we do a lot of posting of notices, flyers and whatnot, as they came out, on how to be, as careful as possible.
Yeah, go ahead. Sorry.
I'm sorry. I was going to say if you had anything to add to that.
No, I think the same here. We're, the same in that aspect.
Here's a question really, relating to tenants while we're on this topic. If they have a note from a doctor, could they wear a clear face mask? And, that's something we haven't gotten in too deeply with. And quite honestly, we haven't had a whole lot of issues with tenants not cooperating. But it is an interesting question. That I don't have the answer to, but it's a good thought. Is if you can't wear a mask, why can't you wear a face shield?
Yeah, I agree. And this came up at this was a big topic and on my last session was, what are we allowed to do legally to make them do it? It is their home. And, the common areas are, it's not like a store where you can tell people they can't come in without anything. We've not asked anybody for a doctor's excuse. And to be honest with you, if I'm in the building, which again, I really try to limit my, anytime, try not to go into the buildings, but a lot of people, I see more people without masks than I do with masks, and they're gathered together, they're all outside smoking, since public housing is non-smoking, they're all outside, just a real little area, all sitting right next to each other. And, I think not necessarily that they can't wear one medically, but they just choose not to, you have your people that still think that this isn't real and it's a conspiracy and all those things. And you're going to have that. I think you're going to have a little bit of everybody. And it's just a matter of how you choose to deal with it, and I think each agency has their own plan on what they're doing. I just don't know that there's any legal, recourse that we have with people that just refuse to follow the rules, and they're not necessarily rules. We are just setting them up as, here's what the guidelines are, so, and like, with maintenance going in, we do ask them if, maintenance is going in there, for them to please put a mask on. And, if they refuse to, then maintenance is allowed to say, then they're just not comfortable coming in, we let it up to them. So that's a tough topic right there. With the enforcing of the masks.
So, speaking of, what we have the legal authority to do, and that's been really tough. And, this is our folks' home. We've always, try and impress that upon our tenants. This is your home. We want you to, obviously you have rules to follow to, you're in a community environment. But, we want you to, feel comfortable here. And now to try and force some of these things on tenants is difficult. But on the other hand, it's in everyone's best interest. And that does come with, living in this kind of a community setting. So, speaking of what we have the legal authority to do, what about evictions and lease violations, other things like that? How have you reacted, with the moratorium on evictions? How have you reacted to those kinds of issues?
So evictions are still happening, just like usual, business as usual with evictions. Now, speaking with other agencies, other housing authorities, it really depends on your judges. Some judges are going to take the cases, and some judges refuse to take them, and that's on them. The moratorium is for rent only. It's not for any other lease violation. So I have successfully evicted throughout the course of this year through COVID any kind of lease violations other than rent. I did have a couple rent cases that right before I had a judgment and right before the moratorium came out, I had a judgment and able to get possession within 10 days, and then that moratorium hit. So we kind of didn't know what to do. And so we waited a few months, and then we retried the case once, we had a little better understanding as to what the moratorium was. And they did evict from it. We do have a couple pending cases right now through our local magistrate's office where people are not paying their rent. Now, with the housing authority, we do rent changes. We lower their rent, the first of the following month for any kind of loss of job, any kind of loss of income whatsoever. We will adjust their rent accordingly. So the moratorium necessarily doesn't really affect our people because they're not affected by COVID. So that moratorium is set that if you are affected by COVID and you cannot pay your rent, you are to pay as much as you possibly can. And then what you're able not to, your landlord is supposed to work with you. However, that doesn't apply to housing authorities who will do a rent adjustment for them. So we actually have pending cases right now. Once you serve them with an eviction notice or you file at court, they have so much time to provide you with a declaration. And this declaration is something that is punishable under federal law for any kind of, fraudulent statements they put on there. And it's saying that they've been affected by COVID, their job, their wages, and they can't be evicted because of it. And nobody has provided us that declaration. So our judges have heard our cases and have successfully evicted for non-payment of rent. Now that wouldn't apply to people obviously that aren't able to do a rent adjustment, but I think majority of us, we will adjust their rent, lower their rent if they had a loss of income. So that moratorium is more for like the private sector as opposed to housing authorities. So, but I know some housing authorities, even with that moratorium, that just some judges refuse to hear any cases that have to do with rent because they're just not comfortable with it. So it's just kind of your judges in your area on if they're willing to take it or not. I have about 4 different districts, 4 different magistrate judges that I deal with. And I haven't had any problems thus far, knock on wood. And I've really been trying. I mean, it wasn't just like the second month I was giving an eviction letter. I'm calling, what can we do? Do you need a rent change? I mean, we're trying to work with everything, anything that we can do to help them, we are. However, they're not paying a penny, I have a resident right now with a family, they make $65,000 a year and they haven't paid me $1, because they feel that they don't have to under this moratorium. They think it just applies to everybody, and that's not necessarily the case.
Yeah, we've had similar experience that for the most part, we've been able to work with tenants, and even those tenants that are not in our public housing that don't get rent adjustments. We've had some families that have had difficulty. We've been able to identify other programs, to help with their rent. But we do have just a very few of those cases where, someone said, well, here's an opportunity for me not to pay anything. So yeah, we've reacted accordingly, but for the most part, we've been pretty lucky, and it hasn't been an issue for us.
Yeah, I agree. I mean, like I said, out of 452 units that I manage, I've only had a handful of people that just are, using that to,
Mm-hmm.
but it doesn't, I think that's pretty good statistics, for, as many that I actually have.
Right. What about, I have a question here about reasonable accommodations. Have you had anything associated with COVID relating to that?
I have not personally have any, I don't know what they're meaning by reasonable accommodation for COVID, or for what, not wearing masks, or what kind of reasonable accommodation for COVID they're looking for. I haven't personally had any.
Yeah, I don't know if the question was directly related to, COVID type accommodations, but maybe just in general, are you still able to accommodate the people with, given the request, and I'm sure, with social distancing and whatnot.
Yeah, I mean, I mean, I think we would look at them just like you do on a normal basis, on a case by case. And but I personally have not had any reasonable accommodations come in during this time.
Okay. Just again, I'm just looking through some questions. What about testing? Employees, have you had any employees testing, or what's your thoughts on that going forward?
So that's a good question. This was another big topic in my last presentation. So we have not had, we have had many cases within our office. We have about 40, a little over 40 employees here at our housing authority. Other than maintenance, who's not in one building. We're pretty spread out though. Pretty much everybody has their own office. We have just a few people that sit in the center in a cubicle. But we have had a lot of people that were exposed. We had about 7 positive cases, and those people were here. We did have a couple people that got sick over Thanksgiving and then came in not knowing that they were sick or exposed, and then that's how it kind of spread throughout our office. So we shut down for about a week and a half, and we had an agency come in, our company come in and sanitize our office. We paid about $5,000 for them to come in, and the material that they used apparently stays on your desk and stuff, even though there's like a little bit of a coating that you wipe off, but the material supposedly stays on for up to 3 months. So we felt that that was the right thing to do. So we had this company come in, and we had 3 companies come in and give us quotes, and we had it done 2 days after we had them come in and give a quote. And knock on wood, since then we have not had any employees. But I don't believe that it's been extended. But there was that COVID leave where you had 2 weeks, 10 working days, where your employer could get reimbursement for your time off. If you were exposed or you were tested positive for it. And as far as I know, that has expired. So I don't know if it's a coincidence or not, but we have not had any other cases since it expired. So, but I know some people actually, some housing authorities, other agencies have actually have like a COVID plan in place that if you choose to travel outside of the state, the CDC, recommends, well, I think actually the state of Pennsylvania put out that you must get tested within 72 hours upon return of being out of Pennsylvania for 24 hours, or you must quarantine at home for 2 weeks. So I think, if people are traveling, they're not letting us know, but I know that some agencies have actually implemented a plan where they have to do things. So I think that's a great idea. I asked for them to share their plans that we could, share to other people if they're looking to implement something like that.
Just looking at a few more comments, and here's one that someone suggested, to show our tenants how to download the Duo app, which I'm not familiar with, but it says that they can see and talk with others. That brings up something that we started. Our staff, our support service coordinator, had the idea about trying to teach our tenants how to use technology, social media, how to use their phones and whatnot, and started a series of workshops using Bloomsburg University students to come in and sit down with our seniors on a one-on-one in a group setting, to learn how to use social media, learn how to FaceTime, all those things that they might not have known how to do. Unfortunately, that happened just about a month before the COVID hit, so we really weren't able to, and it had nothing to do with COVID. It was just circumstance that I wish we would have had a few more sessions so those kinds of things could have been shared with our tenants. But that is a good idea, to find out what kind of apps are out there. And it's kind of a catch-22. If they don't know how to use social media, how can you,
Yeah.
or how to use those apps? But if, there's maybe there's a way that we can get some training to folks somehow to use those kinds of tools. And just a few other comments here about masks. It seems like, there's a lot of, um, a topic that have some other comments on. Susan suggested that, it's based, her knowledge is that you can't refuse someone to wear a mask. Um, you can, you can refuse to meet with them, but you really can't force them to wear a mask. So that goes hand in hand with what you talked about earlier. And then another comment that HUD's COVID Q&A has guidance on enforcing the wearing of masks, and it basically refers to revising and enforcing house rules. So I think that's probably one of those things we talked earlier about, what are lessons learned from this? And, that's something, maybe it looks like we have, maybe another 12 minutes here. So, one of the things I wanted to make time for is just, that type of a comment. How has COVID changed the way we do our business, in property management? And that's one of the things that we've been talking about a lot, is what kind of rules do we need to change? Have we learned anything that really is in everyone's best interest? You mentioned earlier about, when you met with tenants for your yearly certification, you almost always got sick.
Yeah.
So, this, certainly there are some things to learn from just better precaution, in dealing with tenants in, during flu season or what have you. So is there anything, Leila, or anyone in the audience, is there any really key things that you've learned from this pandemic that we're going to carry forward in the way we do business? Maybe in particular, working from home. Are there certain things that property management, in particular, I know you mentioned it's difficult to do everything, but are there certain things that maybe we can do from home or do in a different way to limit interaction with tenants?
Yeah, that's been a a big question about what you're able to do from home and accessing people's private information, their social security numbers, their birth dates, their full names, those sort of things. You're accessing it from home on probably what's not necessarily a secure site, or somehow kind of getting into your computer at work from home, dialing in or something, and that's not always necessarily secure. Then you have your taking of files home, which are never supposed to leave the office, are supposed to be locked up. Somebody did say that HUD has kind of been a little bit laxed on that and has allowed, under the circumstances, because, they're asking people to work from home if you have the ability to work from home. So, we've run into that. Do I want to take home, 50 files, a week, and have everybody's private information in my home, or, in my car, and those sort of things has been a big question on, are we allowed to do that? Because we never technically were allowed to do that, but under the circumstances, I think they've kind of allowed, or maybe not necessarily turn their head, but do what you have to do to get the job done, but also follow the governor's recommendations of, if you're able to work from home, you're to work from home. So I think that's just kind of what your agency allows. Again, another probably policy that should be put in place. I think that's with a lot of things. Obviously this has been a huge change to all of us. If we would have had a crystal ball and knew this was going to be happening, we could have learned apps that we could have implemented, and a lot of things we could have prepared for, instead of jumping in and here we go. We need to make decisions and changes immediately, and kind of just fixing them as you go, because obviously it's not, you just kind of have to just work out the quirks as you go, because there are going to be things that oh, that didn't really work well. But and that's why these kind of conferences and these kind of sessions are great, getting ideas from other agencies, what they're doing, and what they're what other people are, what works for them or not works for them, or same as like the schools preparing the children to work from home, or just do school from home. My kids, they're, I think, more computer savvy at this point than I am, with these Zoom meetings and going in and out of their schoolwork, and they're just 10 and 11, so they've really learned a lot, but the teachers knew this was coming and prepared them for it, And so I think, this is our time now to kind of revamp what we're doing and fix the things we like, and kind of implement it going forward as to what we're going to keep. And at this point we don't know that we're ever going to open our doors again. We're working fine like this. We have a doorbell if someone needs us. There's no reason to have constant traffic in and out of here. So these are just things that we need to look at and decide as we go forward.
Yeah, and I think for us, probably having a presence at all of our facilities, to the extent that we used to, is probably going to change. We always heard from tenants that, there's no one here for us to, have, discuss our issues, or, and this has taught us, well, there's other ways to communicate it. We don't have to have a property manager having certain hours at properties, that we can do without that. Now, certainly, I'm not suggesting that we're going to abandon our properties, but I think we can do just as good a job and more efficient job by maybe not being quite as accessible just because someone wants someone to talk to. And I wish we had time. I wish I had time to go out and spend 3 or 4 hours a week at each project just to talk to our tenants. And but that's really not the case. I think we all know that that's not good business practice. I do want to add one other thing, especially since I know Phyllis Chamberlain is listening in on this session, and everyone knows Phyllis is the director for the Housing Alliance and has done a tremendous, fabulous job through this pandemic, especially on the front of eviction, and really lobbying for eviction moratoriums so that folks that are impacted, by this pandemic are not put out on the street due to no fault of their own. So, when I brought up the point earlier about evictions, by no means are any of us, looking to evict people, but it is part of the business, and it's done as a very, very last resort. So I just want to make it clear that by no means are we promoting or endorsing evictions, only when it's absolutely necessary. So again, I wanted to call that out to to Phyllis, having her all the work that she's done, and then we talk about evictions on one of her programs. So just to clarify, we have
one thing I have for you, Rich, when you talked about your presence being in the building. I used to do weekly manager walkthroughs to each of my sites. I used to also hold monthly manager meetings, and my residents love that. Even if they wanted to just have someone to talk to for that hour, or just someone to listen to their complaints, they really enjoyed that. And I used to get a lot of residents that came down to these. I used to do them in the community room. And I know that wasn't important to them. And it also is important to me to learn what's happening in the building. So what I did is, instead of being able to hold these meetings in person, is I set up a conference call line, and just over the phone, and so then that way there's no Zoom, or they don't have to worry about, computers or anything. Here's the number, here's the access code. They call in on this date at this time, and we just have a building meeting. And they've been just as receptive to that, and we've had just as much people participate that way than in person. So that's just an idea to know that even though we're not there, we're still here for you. We're still working for you, with you. And that's been great. I mean, you can set one up through that freeconferencecall.com. It's free. You get a number, you get an access code, and we just set up a flyer, put them on the bulletin boards, and let them know, on this day, at this month, every month, we're going to meet at 2:00 over the phone, call in, and discuss your complaints, your concerns. And so that's been just a different way of doing things, but it's been nice that they know that we're still here and we still care. And it's, still business, not as usual, but we're still doing business. We're still here, and we're open, and we're here to serve you.
that is a great idea. I know we've sent out flyers and notices and things like that. But I really like that idea. That's something I'm going to share with my property managers again, just to, it seems like a very efficient use of time as well. Um, so to spend an hour or two meeting with multiple tenants, and I'm sure that word will get passed around, and so tenants do feel like they are still valued and we want to hear from them. So yeah, I like that a lot. Another a comment on the chat just came in about sanitizing, and we shouldn't take that for granted. That's critical. We should be cleaning more and more all the time, and not take it for granted. So clean as much and as often and as much as possible, is what the comment says here.
Absolutely.
Yep. So Leila, we have 3 minutes. In conclusion, is there anything we haven't talked about that you think is important for the audience to hear?
I think just to kind of to summarize again, like we said at the beginning of this, I am no expert on COVID or office managing or anything like that. I don't think there really is a right or wrong way. You have to do what's best for your agency. I think that we're going to get a lot more new policies and procedures that come out of this on how we conduct business. I think this is now a good time for you to sit and think about, here's what we did over the past year. Now, what are we going to continue to do? What are we going to change? I know, I've been here for 21 years and there has not been much change. And although I'm okay with change, I'm a little bit reluctant to get to that point. But here we are, and change, is not always bad. It can be good. And so I think this is when you need to, kind of take a look at what going forward, or preparing for, like you said, hopefully not the next pandemic, but for something, kind of like of this nature that affects your business, what you're going to do, because your residents are not going, your buildings are not going to shut down. You can close your offices and you can work from home, but your business stays open. And so going forward, what you can do from home, what you can do in your office, and what you'd like to see, you like to change, but you need to keep, and what has worked out great. And I don't know why we haven't been doing it for the past 20 years, So I think that's like the most important thing, and reach out to your agencies. What are you doing? What are you doing that works? Get ideas. These conferences are great, for that kind of stuff. So, thanks for, having me and letting me, present what we're doing here in Butler. I wish it was more of an interactive session that we could have kind of like open forum and heard what other people were doing, but hopefully you took some of my things and are able to implement them in your agency to help make your jobs a little bit easier.
Well, that's going to conclude our session. I want to thank Leila very much for your input. I've learned a lot, and hopefully others have as well. So everyone stay safe, and hopefully we'll see you in person at next year's conference.
Thanks so much.